All right, we are live. Um, Today we have with us Dr. Jules. And Dr. Jules, hi, everybody say hi. Drop a comment if you can hear us okay. I have
Yes.
things
Yeah.
little bit uh uh what am I trying to say? I have a
Technical
little
difficulties.
different setup today. Yeah,
Okay.
I have a little different setup today. Okay, guys. So today I want to talk to you guys. I want to give you guys the opportunity to hear from Dr. Jules. Hey, Lori, good to see you. That's awesome. Um, I got interested in acupuncture originally when I had a very sick dog back when Gage was really ill. For those of you that have known me for a while, you remember all the trauma that we went through with Gage for months and months and months. And UC Davis was like, hey, you know what? You should consider doing acupuncture. And I was like, okay, I was game for anything. And we talked about the fact that it could, for him, perhaps help his immune system because his immune system was really compromised at that point. And I was really fascinated by the difference I could see in him, not necessarily every session, but like in the particular, this one session, he was really down and I was really, really worried about him and I couldn't get him to eat. And, it was anybody that's been through a chronically ill dog knows what I'm talking about. And we went into a session and he was pretty low. I know now I know that I would say his chi was low. He was chi deficient, but back then I just knew he was just really down. That's what I would say. And they did acupuncture on him, and he literally came out of the session and he had more pep in his step, and he actually ate. And I hadn't been able to get him to eat all day, and that was amazing to me. And it was clearly showing me that my dog felt a benefit from it. And of course, it didn't change the ultimate outcome in his life, but it made him feel better in that moment. So years later, when I heard that Dr. Jules was in town, I somebody had suggested like, hey, Dr. Jules is doing acupuncture, and you may want to check her out. And I had bricks at that point, and that's how we met with my bricks, and the rest is history. We've you've been spending a few years now helping to educate me and try to be a better pet parent for my dogs. And it's funny because over the years, we've done a lot of different things, and we'll talk about that stuff later. But first, tell me a little bit about yourself, Dr. Jules.
All right. Like Sherry said, I'm Dr. Jules. I am a certified veterinary acupuncturist as well as a regular DVM, so regular veterinarian. I started my education in this field in particular in 2019. Sometime that year is when I met Sherry and started treating old man Bricks. And I got into this field to basically help patients like Bricks originally, because you get to a point with a lot of your senior dogs where Western medicine, as you know it, like regular pills and meds and things like that, you come up short for a lot of conditions. And specifically, I was feeling a big void in my old patients. Like they're still painful or they're really weak, but there's not really a medication to treat weakness. And
Right.
so I was like, well, there's got to be more. So I looked around and there were no acupuncturists near me. So I decided I would do it. And so here we are.
Awesome.
Yeah. So
Um,
I live in Angels Camp, California. So I am kind of in the middle of nowhere, but close enough to a lot of you who also live in the middle of nowhere.
right? Absolutely. Tell me about TCVM.
All right, so TCVM is your traditional Chinese veterinary medicine. So it's based off of TCM, which is traditional Chinese medicine, which is the human form of it, which has your modalities like acupuncture, herbal medicine, Tui Na, and food therapy. So food is the original medicine, and then over centuries, they have established that acupuncture, so the application of tiny needles in specific points, triggers systemic benefits. And so those specific points are called meridians, and they kind of run in various locations around the body. Yeah, perfect. So this is the kind of a human meridian trail. So each line indicates a different channel. And those points have been mapped over the centuries to be noted that they communicate for certain things. So specifically kind of along where the spine is right next, so on either side of the spine, not right down the middle, would be your bladder channel. And a lot of those actually have back shoe points. So they're association points that communicate with other systems in the body, which is super cool and very useful to our dog patients. But then just kind of back to what TCVM is, it's the original medicine. It's very, very old and kind of approaches the body from an idea of balance. And so getting your deficiencies improved and your excesses gotten rid of, bring you back to your homeostasis, energetic, normal. Naturally, more naturally.
Awesome. So hang on just a second. So balance of what? Like, what are we balancing? Like, I mean, I balance a lot of balls in the air all the time. Is that what we're talking about? Little juggling balls?
Less physical, but yes. And so you have in your body a natural balance of yin energy and yang energy. So your yin is kind of your cooler energy, your yang is your warmer energy. And so together they are that nice yin and yang that you could show on your screen. If I had given you a photo, I didn't. Everyone's familiar with that symbol. But the idea is that together they balance each other perfectly. So it's like finding the perfect temperature in your car where you're not sweating, but you don't need to have the actual heat on either. It's just like that. But for everybody's system. So you also just have good energy and bad energy. And so with all of the TCVM modalities, you just kind of get your body back to that balance. So it's a balance of energy, it's a balance of warm, a balance of cold. So the energy, like chi, can move smoothly around the body.
Got it. So that's why when you ask me, because I can remember some of our intake appointments, and I say some of because we know I have a few dogs. So we have this. I think I kind of have a type now, but you always ask me questions like, are they heat seeking? Are they, do they, so I have to it's made me think and become more aware of, do my dogs tend to move towards the fire or away from the fire when in the summer or in the winter when we're heating, right? Because that is showing you that there's a lack of balance.
Yes. Yeah. So especially if a dog, even during the summer, is like, I still want to lay in that sun because I just feel cold all the time.
That's great.
I can give you a big helpful insight into how their energetically innards are doing. And then there are other not quite so obvious, like going towards heat or going towards cool, but even like a dog that chews on grass. A lot of times if they're eating an excessive amount of grass is a cold food. So they're usually eating it because they feel hot somewhere. So a lot of dogs that have like an upset belly, they're eating it because they have like stomach heat. So they're eating a cool thing to try to cool it down.
Did you just solve the mystery of why dogs eat grass?
I mean, it's one of the reasons dogs eat grass.
Okay, because I hear that a lot.
I have a couple dogs that are just grazers. They like grass.
I'm just like, they like salad. I don't know what to tell you. Like, vegetables are good for you. But that is one of the reasons when we say, or the idea is that maybe dogs eat grass because they don't feel good. It's they have excess heat and they need to cool themselves, and they recognize that.
Yeah, especially a dog that doesn't commonly eat grass. Like all of a sudden, they're like, I just need to eat this grass. And it's because, something is uncomfortable and they're trying to cool it down.
Awesome. So what areas are most useful for acupuncture? Like, I mean, are we going to cure cancer with acupuncture?
We are not going to cure cancer, although there have been some really good studies about the combination of acupuncture and certain herbs that have really shrunk tumors, which is amazing. Wow. It's very cool. Yeah. Published documents out there, and it's very cool, peer-reviewed journals. But as far as like generalized lymphomas or mast cell tumors, hemangiosarcomas, the goal in those patients is making their disease process less crappy. And so, you make their symptoms feel better. You give them more energy to eat, like Cherry's dog. The idea is that you're kind of just treating them palliatively, or even it goes really nicely if the dog is on chemo, because even palliative chemo for dogs a lot of times doesn't make them as sick as it does for humans, but it makes them feel not great. And so acupuncture is a perfect complementary medicine for that. But yeah, other things that it can actually fix. It can fix acute injuries. So if a dog has like an injury to like a soft tissue injury, or like a soft tissue, so like a muscle, tendon, that sort of injury that's acute, so not chronic, not going on for months and months and months or years, a lot of times acupuncture can actually fix that problem, because that problem is an obstruction of qi. And so if you remove that obstruction, that qi gets to keep going.
Hey, is that the circle the dragon that we did with Gemini?
Yeah.
Right. Well, I remember when we had that, the whole thing that she had with her GI, but part of it was that we had some issues with her leg, and I remember that you talked about circling the dragon, and we really worked that area, and we got healing, of course.
Yeah. Because when we stimulate those acupuncture points from a Western standpoint, we are bringing in all sorts of good cell mediators. So things to kind of clean up the inflammation, or even bring more inflammation to help clear out the bad stuff, and improve circulation in those locations, get blood flow going, and then even stimulate a lot of like neurotransmitters that make the dog just feel better too. So from a Western standpoint, you're kind of accelerating the healing process.
Okay, awesome. What other types of things? Because I know there's, I have been amazed. Like, I understood that it worked well with Gage, and with Bricks, I sought you out because he was kind of having typical German Shepherd rear end weakness, right? And that was good. But as I've gotten to spend time with you over the years, and as my dogs have had things happen over the years, there's a lot of areas that acupuncture can be beneficial in.
Yes, and yeah, definitely what brings clients in is the arthritis. But then I'm like, oh, but your dog is also doing this. Let's do that. And so a lot of those extra add-ons are, my dog has loose stool once in a while. So great, I will also tonify the spleen channel for its deficiencies or its excesses. And you can treat the diarrhea. You can improve their absorption through helping their body heal, which is amazing. And you can, help dogs with anxiety. You can help dogs with skin issues. A lot of skin issues, including allergies, can be really, really helped from acupuncture and herbal medications. It's been amazing to watch some of my patients just like flip a switch. Not all patients respond awesomely, but and a lot of times they still benefit from complementary, Western medicine. So I say complementary because I prefer acupuncture these days. But dogs might still need Apoquel or things like that. But to manage more of their flare-ups, acupuncture and herbs can be fantastic. It can also be helpful for even like reproductive issues. So if you have a bitch that's not cycling normally, then that can actually be helpful in regulating their cycles, which is amazing. Low sperm count has been shown to be responsive to acupuncture and herb as well.
Oh, wow.
I know. It's very cool.
Wow.
Kidney disease, autoimmune diseases, heart disease. Yeah. I mean, chronic things, like I said, are not going to be cured per se, but they can really be curbed, in which case the progression is slowed, which is really cool, especially for older patients.
So one of the things that I notice is that we're very, when I go in to see you or any vet and with in a Western medicine standpoint, I'm usually like, okay, what's our plan, right? And we have this big plan. But when we're doing acupuncture, we're always very in the moment. We're very where we are today, and we never have a big plan. I don't think, I've just sort of realized as I'm listening to you talk, I'm like, we've never had like, hey, we're gonna do this and we're gonna do that, and we're gonna do this. You come in, you look at the dog, and you reassess every single time.
Every time. Because every time it's different. I mean, dogs are not a one shot static being. They're dynamic. They do things like eat stupid things that now they have diarrhea. So they're always an evolving picture. And every time you've seen it, I look at their tongue, I feel their pulses. Yeah. And like you said, I ask what has changed. And then we get that new baseline for today. And that is what dictates every specific treatment.
And so then you take that new baseline, and this is stuff you do, we don't necessarily talk about. So it's interesting to me to be like, okay, so then you talk about it, and that makes that helps you decide where what points you're going to use.
Exactly. Yeah. Exactly. Okay. So if I'm if I'm treating a dog for, say, stifle arthritis, so I'm going to put a lot of needles, ideally right near the location. But then I'm also going to go ahead and I'm going to treat kind of systemic things that contribute to that arthritis, including tendon and ligament weaknesses, because that's probably why they have the arthritis. And then you're also going to treat bone. But if you're like, oh, but my dog has been having those loose stools too, I'm going to put in some points that help tonify the spleen that same day, even though the main issue was the stifle, because they're there, and that's holistic medicine. You treat the whole picture because, again, it's all about balance. So if they're deficient somewhere else in that day of appointment, great, let's work on that today too.
And every time you're looking at where they're at and you're trying to push them a little bit closer to that balance. Yes?
Exactly. Yep. So if they're painful, I try to alleviate the pain, or if they're showing signs of deficiencies, I try to tonify that deficiency and kind of bring their baseline back up to that normal balance.
So are there things that people can look for in their pets that they would help them identify that acupuncture might be good for them, that their dog is out of balance, so to speak?
Yeah. Other than limping, right? That's a nice, easy one. And as I mentioned, musculoskeletal is pretty common. A hair coat change is a big one. So if a dog that used to have a really wonderful coat, no dandruff, suddenly their coat's kind of dull, or you're noticing that they have dandruff, that's a really easy one. And I mean, I'm not going to, every case is definitely different, so I can't tell you definitively what the diagnosis would be, but it could be something like a yin deficiency or a blood deficiency, in which case tonifying it could be helpful, and seeing an acupuncturist to get to the proper diagnosis would be helpful as well. Sometimes
whoa. Did you just say dogs don't have enough blood? Like, is there a vampire?
There's a vampire going around. I mean, there are, right? Ectoparasites are real. But no, so blood deficiency, sorry, since I opened that door, I guess, is a similar idea as something you can have not enough of, or it can also be stagnant, in which case those patients are very painful, and that kind of shows up as a bruise physically a lot of times. But that too can be out of balance. And yes, when it's low, patients can clinically be anemic on paper. So if you did a CBC, you would see that their red blood cell count is low, but not all. There are some that clinically on paper are normal, but their tongue is pale and their coat is poor, and they have other signs that point them towards having energetically a blood deficiency, in which case you can modify that either with diet, herbs, acupuncture.
Gotcha. Okay. Yeah. One of the things that I see you always look at, I mean, pulses, but I don't know that and I'm pretty experienced, but I don't know that I would be able to gain much even as a pet owner with those pulses that you do. I think that's pretty specific to you. But one of the things that I have learned to look at in my dogs that helps me identify things is their tongue color, right? And I understand, like, okay, when it's pale, and we know we want this healthy pink tongue, but one of the things that really surprised me, and I think it was with Junior, you were like, he's purple. And I'm like, he's purple. What does this mean? And I want you to talk about that, but I will say I've seen it in client dogs since then. Like, sometimes I'll be like, oh, your tongue is purple. You need to go see acupuncturist, right? You need to go see Dr. Jules, because we need to fix that. And Junior is like my super active dog. So I was so shocked when you're like, he has purple tongue. He's stagnant. And I'm like, how could he be stagnant?
The first time I told you he was stagnant is when he was actually stagnant in the mind.
Yeah.
Right? He was like being really activity restricted, and he was, so that purple tongue, one, can mean so many things, but in Junior's case, it can mean that he is actually physically painful again. So stagnation is, again, that kind of blockage of your chi, or your blood. You can have blood stagnation too, where again, that's that bruise that's really painful. But if you work on that stagnation, you get the chi flowing again, that purple tongue will slowly start to improve over time. And the tongue is a complicated topic because it's much too complicated to fully go over. But yes, it can definitely be a really good window for a lot of owners as like that's not a nice normal pink tongue. I wonder what that could mean. And yeah, a purple one is a good one to recognize because it can definitely mean stagnation where, like I mentioned, Junior, he was stagnant because he was cooped up. And so he was like just energetically needed to get out, but he couldn't because he was rehabbing. But it also can be stagnant from being physically too painful or sore.
Right. Okay. So yeah. And so, I mean, I think what would be really good was for people to understand that like they can look at their dog's tongue and really discern a lot, not necessarily know how to fix it. Cause I couldn't tell you how to fix it with the purple tongue, but I've had since then, I had a dog who had a seizure and we've realized that that was an issue for her. And we had some herbs that actually helped.
Yeah. Cause she had some stasis in her mind also that then resulted in the seizure activity.
Yes.
Yeah.
So is this a good example of a nice pink tongue? I think this is Lotto.
That is Lotto. Yes. Hi, buddy.
Hi, Lotto.
Yeah, from this image, it does look pretty pink.
Yeah.
He typically was a little yin deficient, so many of his appointments, his tongue was actually a little red and had some cracks on it. So we tonified his yin a lot, but it does look pretty pink in that photo.
So yeah, good. So that's really the thing, right? Is that as you keep dealing with these, how long does it take? Like how long before we're balanced?
And that is one of those things that in this class, we learned that it depends. So again, those acute issues like acute diarrhea, acute lameness, a lot of times can be just a couple treatments. Chronic appointments, so dogs that are dealing with back injuries or weakness or really chronic arthritis, a lot of times they'll take 2 or 3 appointments before you see any improvement. Many of them, it might be like every 2 to 3 weeks for a couple months before you're really satisfied with how they're doing. But a lot of my geriatrics, it's like tune-ups every 2 to 3 weeks is what keeps them ticking.
For sure. And that was definitely my experience with not only Bricks, but Bricks, Diva, Conrad. And we were just constantly working to help them feel their best.
Yes.
And Bricks has my age record, right? So he died just before he was 14.
Exactly.
So I really attribute a lot of that to the acupuncture that we did.
Yeah, I think that kept him feeling his best as we could for as long as we could.
Yeah. Okay. Well, what else? What else do you want us to know? What do you want people watching this to know?
Gosh, I just want them to know that this happens. People do acupuncture on dogs, right? Because I think that there are a lot of clients that are like, "You do what?" when I tell them that I do this, and it never occurs to them that they could do that as an extra thing to do. Now, this is my Bricks, obviously.
Yes.
Your Bricks' namesake.
Yes.
She's getting some acupuncture, and she's a rock star. And that's the other thing I want people to know is that most dogs, I would say 90% of my patients are fantastic. Like, sure, they're a little weird about maybe the first treatment or 2, but then they realize that I felt better. Like, they catch on. The smart ones, they'll walk right through my door and they'll lay right down. And you're like, that's so sweet. But yeah, those are the 2 big things is that it's out there, we're doing it, it's working. And most dogs are really good for it. I will say that cats, it can be done. I've had mixed results. I treat my own cat. He's really wonderful, but I've treated a couple client cats and they're hard, but as long as owners are patient and we all find that zen, it can be done. And I've also seen it really help some cats. So.
Awesome. That is really good to know. Okay. And how can people reach you?
So I can be reached at Dr. Jules, DRJULES, at hillsideholisticvet.com. My email is the preferred way of contact just because I actually just have bad cell service where I am and phone calls are trickier. So email, I also feel like gives me a lot of, client information right off the bat. I can find out who you are, what your dog is, what your problem is, and get back to you on whether or not I think it'll be a good fit.
Awesome.
Mm-hmm.
Okay, well, awesome. Thank you so much for joining us. I think hopefully we've gotten you guys that are listening to this, you guys have some ideas about what to look for and what might be helpful for you guys. And then
Yeah, awesome.